Eastern Cape Premier Oscar Mabuyane met with the Provincial Department of Health and National Minister of Employment Creation and Labour in a bid to find a solution to the decision to close the Frere Hospital in the Eastern Cape. Now, measures to curb COVID-19 at the hospital have been criticised as not being satisfactory. Premier Mabuyane joins us on the line now. Premier, thank you so much for your time. Now, you held an urgent meeting between the Provincial Department of Health and National Minister of Employment Creation and Labour about the concerns at the Frere Hospital. What was the outcome of that meeting?
Good evening to you and your viewers. That is correct. We had that very urgent meeting this evening. We just finished that meeting. In principle, we agree that the matter should have handled differently without undermining any constitutional mandate of the Department of Labour and its inspectorate division. But how the process was handled was also really not sensitive to the public interest if you talk about a hospital of that nature. But clearly there were some other issues that were really not followed to the latter in terms of the chronological flow of information. We've just agreed with the minister and the team, DGs and everyone who was in the meeting that let's actually go back and actually close the gap and supplement all the necessary information that was actually missing because from the Provincial Department of Health, everything was done. And how the process was also done in terms of inspection, there were some gaps. But we have agreed that we don't want to go back there. We must fully comply. That compliance is what we need. We must respect the laws that we are actually enacting ourselves. So my interest as a Premier was to ensure that the government of Eastern Cape complies and the Department of Health in particular does what is expected. And we have agreed that first thing tomorrow morning, the inspection team is going back to the hospital to actually conclude the work that it was doing as all those aspects that were actually questionable were done. These were really low-hanging, soft issues that could have been fixed easily for the same day for such a decision to be taken.
Now, Premier, there's obviously a lot of concerns in the community and obviously in the country at large. Now, let's backtrack a bit. So the Labour Department insists, though, that it did give East London's Frere Hospital specific directions on how to deal with COVID-19, but that these were not undertaken, hence the immediate shutdown calls. Now, are safety measures to stop the spread of COVID-19 inadequate at that hospital?
The hospital is one of the biggest hospitals that we have in the Eastern Cape and is one of the first hospitals to be ready to handle any case of COVID-19. I've visited the hospital myself. I've seen it, how ready the hospital was myself, and that's why it came as a very huge shock what was reported to be the issue. I think the issues of triaging centers where you needed to do a thorough screening of people who are coming in. These are things that we have done, and we've done it even in other simple, ordinary hospitals in rural areas, that we make it a point that all hospitals are insulated from further infection. So these are things that we were actually not really sure about what exactly happened, but the SG of the department, MEC, were informing me in the morning when I asked about this, and even in the meeting, giving that full account. But we have said, whatever case it is, we are not there now. We just want to fully comply. We want to respect the laws that we have, and we want to work with the inspection of Department of Labour. Let's just be professional on that. Let's all go back there, clear all these issues, because according to the report, those are issues that were actually answered to, even during the time of inspection. And there seems there was a communication breakdown between the inspectors as well as the managers of the hospital.
All right. Now, we understand also that things got equally tense between the two departments, that there was also a legal process that the Department of Labour was looking at going, and that the Health Department was obviously wanting to keep the hospital, open. Whilst these legal issues are ongoing, and while you are going to go back to the drawing board and make sure that you comply, what is happening on the ground in as far as the hospital is concerned? Because we know that the hospital services a very large part of the Eastern Cape, and it's not really only COVID-19 matters that are being serviced at that hospital.
That's exactly the point. The reason that the department felt that probably the court process would have been an ideal situation to actually delay the effective implementation of the prohibition that was done by the inspectors. The issue was that you have got about 800 patients in that hospital, that you cannot just sleep and wake up tomorrow and say take them out of the hospital. And we're not saying by that there must be no compliance on issues that must be fully complied with. But we're just saying the process that would have been actually followed, at least you should be giving that. Because the argument is that no enough time was given even to the department in terms of what law says, 14 days, etc., etc. That issue of us and them is neither here nor there. And what we have said with the minister, we are here now. This matter should have been sorted, and there is no government must be taking another government into. This is a one government of South Africa. These are issues that are within our responsibilities. There is a minister there with an executive authority. We are here as an executive authority as well in the province. These matters should also be escalated at that level without interfering with what is supposed to be done. Law says inspectors' decisions are final, but we're saying those decisions must also be sensitive to public interest. But we are saying give those things the due processes that must be complied with. That's why we're saying even if you could go back there now to redo the inspection, you will be finding the hospital more than ready, because the hospital has been ready to actually handle the cases of COVID-19. It's one of the first hospitals actually in the province. And it's the biggest hospital for that. But we're saying all those minor issues are not issues that we should have allowed them to go to the extent where they are. Even the inspectors feel like things have not been sorted in the manner in which they were actually making a report. We are attending to that. We are putting leadership there, in both me and minister, to ensure that there is no court that will decide on that. We must be able to facilitate, respecting laws, of course, compliance must be there, that all the issues that need to be addressed must be addressed. Issues that must be fixed must be fixed. Because all those issues that are raised there are really soft issues that actually need not even much time to be resolved.
Now, Premier, before I let you go, and a final question from me, can you guarantee tonight to the South African public, more importantly the Eastern Cape public or community, is the safety of employees as well as patients guaranteed as we stand tonight?
Definitely yes. Definitely yes. That's our preoccupation and that's our priority. The safety of our workers, the frontline professionals, in this case, general workers in those hospitals across the province. That's what we are attending to every day. That's why we've got our occupational health safety committees in every hospital to ensure that we work together with our critical stakeholders like labor, etc., to address all those issues on the spot as actually they arise. I can assure you that come tomorrow, by end of business day tomorrow, all the issues that probably could be issues lifted or crystallized by the labor will be sorted as they have been already sorted. But because of the process, the inspectors, we have agreed they must go back there and relook at the process that they've done, and they will definitely get the hospital more than ready.